While they're usually reserved for war zones and natural disasters, a field hospital is being built in the nation's capital. The pop-up emergency department is the first in Australia to deal with a potential surge in COVID-19 patients.
The Prime Minister calls this a battle, and now it's starting to look like one. A field hospital taking shape in the heart of Canberra.
It will look like, I'm told, an emergency department inside with all the right clinical care.
When complete, the steel demountable will hold 50 beds with 6 resuscitation bays.
So we just want to be prepared.
Preparing for a potential surge in COVID-19 cases as other cities around the world are overwhelmed. A similar pop-up hospital erected in New York's Central Park, while an ice rink in Madrid was turned into a makeshift morgue.
Anything to deal with this onslaught of patients that we may experience.
Recording just over 100 infections so far, Territory health officials are hopeful they can stay on top of the virus.
The more we can plan, the more we can plan for the worst, but expect the best or hope for the best.
There is a chance it won't be needed. There's also a chance that more may be needed. I think we're operating in really uncharted territory.
Aspen Medical winning a $23 million contract to build the temporary emergency ward, as they've done in the past, hired by the Australian government in 2014 to help respond to the Ebola epidemic in West Africa.
It's what we're used to. We've set up hospitals in Iraq, in Africa, in Sierra Leone and Liberia.
In the ACT, the race is on to get the facility up to scratch.
We've got to secure the equipment, and the rest of the world's trying to do the same. And then we need to recruit staff.
Construction is moving at a rapid pace to get this field hospital up and running by the end of May. It's being built right across the road from Canberra Hospital, so the two facilities can work in tandem, boosting the Territory's capacity to respond to the pandemic.
We are trying to build enough capacity and create enough capacity to manage what the modelling tells us could be the demand that's coming.
So far, there have been no requests from other states for similar pop-up hospitals, but Aspen not ruling out that option or the potential to help abroad if the pandemic begins to ravage the Pacific.
We'd always be willing to help.
Eliza Edwards, Sky News, Canberra.